The journey to fertility is sometimes very difficult for some couple. And this episode is just to talk a bit about infertility. If you are in that situation or someone you know is going through that situation, I want you to know it's not the end of the world. Having understanding about infertility and the causes might be able to help you. So stay tuned. Welcome again to another episode on DrBeeH's channel. Of course, my name is Dr. B and this channel is for you. Infertility is the inability of a couple to have a child after 1 year of frequent and unprotected sexual intercourse. So the intercourse is frequent and the intercourse is unprotected. Because if you've just tried once or twice in the space of a whole year, or you've just tried for about 3 months, medically, we do not classify it as infertility. So I want you to take note of that definition first. The other thing I would like to talk about is that there are a few exceptions to the rule of 1 year. And those few exceptions are if the woman has had a prior history of no menstruation or very irregular menstruation, then she might want to seek help even before the period of 1 year. If the man has had some issues of probably undescended testes or testicular torsion or some history in the past, that might be a reason to see the physician before 1 year. So I'm just trying to say that there are exceptions to that rule of 1 year, or when there are medical conditions that definitely impact the ability for a conception, then it's better to address the issue headlong. We have two types of infertility. We call one primary, the other secondary. Primary infertility means this couple have not had a child before. So they are trying to get a child for the first time, to achieve conception for the first time. Once a woman has been able to achieve a pregnancy, then it is not infertility because she could achieve a pregnancy. Carrying it to term is another kettle of fish, but she could achieve a pregnancy. So if a couple has not been able to achieve a pregnancy, then it's primary infertility based on the definition I gave earlier. And it is secondary infertility if they've been able to achieve a pregnancy, but achieving another pregnancy now becomes difficult. They had a child and now they're trying to have another child. The same people who had the child are just unable to have another child. Now, we understand the process of infertility for those who do, and for those who do not, I want to quickly talk about the fact that it takes the man and the woman to achieve a pregnancy. So sperm from the man and eggs that have been released from the woman come together to achieve a pregnancy. I'm using very simple and lay terms to improve understanding. So it is that process. Yeah, there are a few things in between, and if you don't understand how a woman releases her eggs, you can check the podcast I had on polycystic ovary syndrome, polycystic ovary disease, to understand that better. So in the search for a solution to infertility, it is important that the couple seek help together. I'm saying this particularly because the woman carries the pregnancy, there is a tendency to always focus on the woman. But before you start the diagnosis of what the problem might be and looking for solution, you should seek help as a couple. The man should not seek help alone. The woman should not seek help alone. To go together as a couple because you're both trying to achieve a pregnancy, right? In the start of a process, you want to check what we call male factors and female factors. Before you do any other thing, there are questions the physician is going to ask. Is the woman menstruating regularly? What is her history? They will ask history to rule out any health issues that might be the problem, because sometimes there are health issues that actually affect or prevent people from being able to achieve pregnancy. Health issues that probably have impacted their hormones. And that takes me to part of the evaluation, which is they check their hormone level, apart from the history, and they do some other tests. Before they go into other tests that could be a bit invasive, they also want to check the sperm count of the man. There is a normal sperm count that is expected in a physiological man. And apart from the count, you also want to look at how healthy the sperms are, because the sperms have to travel to where the egg is in the fallopian tube. So if the sperms are not healthy, the likelihood that they get there safely becomes slimmer. So they might die before they get to where the egg is. So it's not just the count. They're looking at the count and they're looking at the health of the sperms. You want to do that and also check the hormonal levels of the man. Is it low? Does he have low testosterone level? There are some basic things you want to do, because as the investigation goes on, the investigations can be invasive. That means it's not just what you get answers to with a blood draw or with asking simple questions in the woman. You might need to go invasive and do a salpingogram. We typically call that HSG. That gives a view of what is going on within the uterus and the tubes. We want to be sure that there is no blockade or there is no irregularity in the outline. And the idea is when a dye or fumes are passed through the cervix, it travels up into the uterus and into the fallopian tubes of the woman. And as this is traveling, series of X-ray shots are taken so that they are seeing the view per time. The flow helps to know whether there is irregularity of the uterine outline or there is a block in the fallopian tubes, because that helps to know what the problem could be. Now, all of that has been said. There are situations where there really is no problem with the man or the woman. They are just finding it difficult to achieve a pregnancy. When all of that has been identified, whether a cause was identified or not, there are other ways that they can achieve pregnancy. We have many interventions now. We have the IUI, that is the intrauterine insemination, where the insemination is direct into the woman's uterus and it just aids the travel of the sperm to get into where the eggs are. And then we have in vitro fertilization, which is now a bit more popular than it was some years back. That said, a lot of these interventions can be very, very expensive. And it is important that a couple sit down together, plan this together, and seek help early. They don't have to wait until the woman is now advancing in age and then it is more difficult for her to produce quality eggs. So remember, if after 1 year it's difficult to achieve pregnancy, it is time to seek help. That said, as some of you would have seen in my description, I'm not adverse to miracles. I know miracles do happen, and I'm a recipient of a miracle. I experienced primary infertility. We sought help and we knew what the problems were, but we couldn't afford the interventions that were available at that time. But we had hope and we trusted God. And guess what? I got pregnant without any intervention. And to God's glory, I have 2 kids today. So seek help and trust God. But definitely, you are not in this alone. Infertility can be taken care of. And I will be praying for you that very soon you would also be able to achieve your desire to have a child. Until the next episode, I remain Dr. B. Take care and stay well. Bye for now.